Hello, hello, hello. How you all doing today? All right, it's Troy Wise, and I am here with This Week in Supervision. It's a Friday. Yes, it is a Friday, and man, I'm glad is what they say. Thank God it's Friday. Well, I want to go on and get into what we talked about this Friday, or some of what we talked about this Friday, and all week, and these topics can get kind of touchy because I'm not gonna lie. This particular topic that we're going to talk about today is about a young child who has experienced some significant pains, right? And as I was preparing this, it's not even a real case, and it just started impacting me emotionally. I mean, it was kind of just going, I'm an empath. So it was just going through my body. Even I was talking to some of my supervisees, and I was like, I'm really feeling this because I don't know if you're like me, but I have experienced working with children who have experienced abuse, and I worked a lot with adoptions, and I worked a lot with individuals who experience trauma and foster care, right? And they have a special experience, and it kind of just made me sensitive as I was going into this particular story as I was creating this story. So we're going to talk about it today, and the title of today's This Week in Supervision is, can you solve this child's story? Okay. We've been talking a lot about ACEs. We've been talking trauma. We always talk about that. Psychotherapy. We do case management and things like that. So since we were talking about it on the past couple of weeks, we want to see how well you might be able to identify ACEs from a particular case. So what I'm going to do, like what I did in the group, is I'm going to show you a um a quick little scenario and see if you challenge yourself to see if you can identify the aces here and score it without even having an ace in front of you, because the ace is super important, especially when you're dealing with individuals who have trauma experiences, right? But this is where it all starts in childhood, right? Well, so I'm going to go through it real quick. I'm going to share my screen, and I want you to jump in with me and see how many aces can you see. How many aces can you see? So I'm gonna read this real quick. So we've got Marcus. He is a 12-year-old. He was born to a 19-year-old mother with untreated depression who went days without responding to him. His father was arrested for domestic violence when Marcus was only 14 months old, and then he was sentenced. His dad was sentenced to 18 months in prison. With the father gone, his mother began drinking. CPS or DHR entered the home, and Marcus was 16 months old. He was underweight, and he had untreated diaper rash, and there was almost no food in the apartment. Now, his dad, he never came back home. He was never reunited with his father, as far as in the home. So he was removed at age 2, right? At age 2. This is crucial. He was removed from the home at age 2. On one occasion, he was removed early. And he had 5 placements since then. He's had 5 placements since then. He's only 12 years old, y'all. 2 disruptions due to his behavior. Now, that may be a term that is new to some of us. We'll get back to that, but what's a disruption? 2 disruptions due to his behavior. One ended because the foster mother became ill. One ended because the foster mother, Janet, the first adult he had ever began to trust, died of cancer. Can you imagine that you have a child that has been neglected, possibly even abused, right? And unable to connect with parents because of different situations, right? And then once this child been from place to place, and once the child finally connects, they lose someone, right? Think about what that can develop in that child as they become an adult, or what can happen to that child just at that moment while they're experiencing that. And so, this is where we have the scenarios when we're actually working with adults or working with the child that we see that's sabotaging things, right? Because this becomes commonplace, right? Because you want to get in front of the story, you want to avoid things just happening to you. So it's a faulty way of trying to take control, but you start to cause things to happen for protection, right? Because this is the type of person that might not always, but sometimes might be in a situation where they're in a relationship, things are going well, and just like Lamar on a week ago or 2 weeks ago, you start kind of messing things up because you're afraid that someone is going to leave you, right? Okay, so this is what we kind of jumping ahead, but this is what happens in these scenarios. Okay, and we have to know this as therapists. So Janet passed, and she died of cancer when Marcus was only 9 years old, and he had not. It wasn't because of him. He didn't have anything to do with it. But his nervous system began to get flooded. Okay, and he was adopted later by David and Karen at age 9, 6 weeks after Janet died. So he didn't even really get an opportunity to fully, well, you don't ever fully. He didn't get an opportunity to grieve Janet before he's moved into another placement, which was a good thing, possibly for him because he needed to be placed. But at the same time, what type of care did he get to help him to adjust and adapt? Right. He ended up, in a newer another home with David and Karen, very loving parents, had the best intentions for him. At age 9, 6 weeks after Jen, they knew his full history, so nothing was hidden. By the way, if you've been in this work, sometimes information is hidden. Oh, I didn't hide any information, but sometimes I worked in adoption, foster care. Sometimes they don't get all the deets. All right. They chose him anyway. 3 years later, here's where he is, right? Compulsive lying about things that do not matter. Now, I'm going to tell you something. I think it's in the science, but something that I experienced trending with children who are adopted in foster care is lies. I can't remember what it was. Check it out. Okay. It's a thing with lies. Okay. I would see that trending. And if you worked with this population, you might be aware of that. Destroying property in the home. What kind of condition? Because I want you to be in diagnosis mode, because I want you to be thinking about right now what diagnosis this child has, because that's the next question after the ACEs, right? So I better hurry up. Um, Destroying property in the home, a false abuse allegation against David that didn't amount to anything. Oh man, he's trying to help him. Physical aggression towards Karen, the person who showed him the most warmth. No friendships, does not seek comfort when he's hurt, isolates after conflict. Told his therapist, I don't need anybody. Told David, you know what? You're going to have to get me back. You're going to have to give me back anyway. Um, Everyone else does. I might as well make it happen. So he's thinking, you're going to have to, I'm not going to be able to stay. So why get comfortable, right? Okay. And then last week he drew his case manager a picture of a house with 4 people in it. He wrote her name under one of them. That's what eats you up as a social worker, because that child is attaching to the social worker. He has a social worker in the picture because they formulated a relationship. David and Karen are requesting disruption. Karen is afraid in her own home. David says, we love him, but he's got to go. All right. So that's where we are, y'all. That's where we are. So I want you to think about, from what you got right now, it's circling in your mind. Can you identify a few ACEs? Again, these ACEs are attached to negative outcomes, unfortunately. I don't know ACEs that attach to positive outcomes. At least that hasn't been researched. So they're attached to negative outcomes that predict cardiac, uh, you know, and if you're going to have issues with your health, all kinds of stuff, if you're going to be able to be functional in relationships, that it tracks a lot mortality. Okay. What ACEs do we have here? Well, let's flip up to find some of the answers. And a lot of them are in that first paragraph. As you can see here, untreated depression. His mother, 19, she was young, had untreated depression. That's going to flag as an ACE. Okay, I don't have the ACE up in front of me. I wish I could join it here. Domestic violence. that is going to flag him as an ace. Being, a witness of domestic violence. His father was sentenced to 18 months in prison. That's an ace. So already we have about three. With the father gone, boom, mom can't cope. So she starts drinking. She was young. She's having to do all this all by herself. She begins drinking. That may be an ace if she's becoming an having substance use issues. CPS entered, and he was underweight, untreated diaper rash. There was no food in the apartment. Okay, and so these are all aces. This is showing neglect. That the aces show the neglect. So we're probably going to have about 6 or 7 aces here. Let me see if I have something that kind of identifies this. But one thing I want to bring your attention to is disruption. Some of us are not maybe familiar with that term. It's important to be familiar with that. That's when a child, he's been adopted and he returns to foster care, and a new placement is sought. Okay. And a lot of times that might have been before the full legal was done, but a dissolution, I believe, is the term, might occur. A child can be returned, believe it or not, after adoption. And that's scary. And I don't know how many of the kids know that factually, but sometimes they're thinking it even if they don't know. So the family dilemma. So before we get to judging the family, and this is some of the things we had to talk about. We talked about the how to approach the family when you're being an advocate, but then for the child, but also being empathetic for the family. There are so many things besides just what we see with Marcus that happen when a parent, an adoptive parent or a foster parent, determines that I have to return the child. And sometimes we might think, well, they should just deal with that. But we talked about some scenarios. Think about some scenarios where this might be the case. Well, for one thing, Karen, she was being abused. And she's saying that he has to go back. But the social worker in this case is saying that is going to destroy him. So whose side do you take as a social worker? And we talked about that, and the answer is no side. We just have to protect the safety of the client, but also be empathetic of the situation of the parent, right? And some of these parents, it's terrible, because let's just say, what if he had been? We're going to go to the extreme. What if he had been sexually abused himself, and then he comes into the home and he's sexually abusing his siblings, which are the biologicals of Karen and David? So these are situations sometimes when you have a child, you may not have known that they have been through that. And we used to work with a lot of these cases, right? And so there is a struggle because you understand the pain of that child, but then you are protecting the other kids in the home. It can just tear you up. And so we don't want to judge, but let's get back to these aces here. Here, what did you check off? Here we already checked off emotional neglect, and remember that the aces are pretty much sectioned off by abuse, neglect, and mental illness. Okay, abuse, neglect, and maybe household dysfunction. Should we say abuse, neglect, and household dysfunction? So we got to move. We got to move. So multiple choice question, right? Well, did we get to that right now? Yes. Based on the case that you have just seen and heard, which of the following best identifies Marcus' primary diagnosis? Oppositional defiant, conduct disorder, reactive attachment disorder. And they're giving y'all hints. See, on the test, these little hints, they're not going to be there. Antisocial personality disorder, right? Which one do you believe it is? And we got a series of different answers. In my last group, we got a lot on the right answer, or the answer we were looking for. And guess what? That is reactive attachment disorder. With reactive attachment disorder, you have a child who has been in a situation where the caregiver situation has not been consistent. And because they are reacting to certain things that they see, they end up not usually being able to attach well. And that's what we see in this case. So the answer is C. Okay, and so let's look at some of the criteria that helps that supports him having a diagnosis of reactive attachment disorder. A very good a very good film to watch or documentary is Child of Rage. And I'm gonna have to bring that back to the group's Child of Rage, and it goes into a deep story about this young child that was abused. This is a thing I want to give it away. This child was abused when they were young, but remembered everything, and it just impacted. She went on to abuse her. This is a real story. Went on to abuse her brother, but she had a positive outcome. So it's interesting to watch. But rarely seeks comfort. Okay, so we see where he demonstrated this. Rarely responds to comfort when offered, pushes caring away, limited positive affect. I don't need anybody. That's a protective thing, because you know what? If I let somebody in, then what's going to happen? When has that ever worked out? Okay. Explain irritability during non-threatening interactions, aggression towards caring, specifically the warmest caregiver, pattern consistent with pathogenic care. And we see that he was removed at 2, right? Okay, so I think I have some of the core things. And maybe I don't know if I made another multiple choice or not and put it in here, but this is what I want to ask you all, okay? And I was meaning to put it in. So age, at what age do we diagnose? Okay, and that's why I bring the video in. What age do we diagnose reactive attachment disorder? Is this something that can be diagnosed throughout childhood? Or is this something that occurs? And I'm looking for y'all to put something in the chat here, but that's not happening. I'm used to doing that in supervision. Just put it in the chat. What do you think? What do you think? And that's how you keep it, keep it going. But at what age do you know that? So this is what I'm here to do, is to help if you don't know. Okay. And so to keep the supervisees somewhat entertained, what I like to do is show a quick clip or video, which when I'm trying to do that here, I can't ever find it. Right? Right? Okay. So so let me get down to that and see if we can find what we're looking for here. Okay, there we go. All right. Check this out, y'all. So this is the thing that you don't want. You don't want to be that person. Okay, I gotta wrap it up. 35, 45, 55. All right. You don't want to be that person who makes a diagnosis and then something goes down and all of a sudden they're pulling your records to see if you properly diagnose. And so this is what we try to do to help our supervisees to do well with understanding the DSM, do well with case management, do well with understanding medications and things like that, because it helps, right? But this is a case, I don't know much about the actual case, but let's listen up, because there may be something interesting that you learn. We're just going to play like 2 minutes from this that you didn't know about reactive attachment disorder, or RAD. Let's see if we can share. Let me try it again, make sure the volume is connected, so y'all won't be able to hear it. All right, here we go.
10 years old, correct?
That would be right.
And you're familiar with the DSM and the criteria that they have for reactive attachment disorder, correct?
Yes.
That manual also provides some.
So I should have said she is some of you all may do this or may end up doing it. It's she is what do you call it? Basically she's paid to consult the courts on, and I'm blanking out on what is the title, but she's paid to consult the courts as being a specialist in psychotherapy. She's a psychologist, so she's being called on to give her expertise on something related to what we've just been talking about, right? And she actually started to evaluate another clinician's work who happened to be a LICSW, right? And so anyway, she's given her assessment of things.
Cautionary instructions that practitioners should take into consideration when reaching a diagnosis, correct?
That's true.
And some of those cautionary instructions as it applies to reactive attachment disorder is that it shouldn't be diagnosed after the age of 5. Or if it's done, it should be done with extreme caution.
I agree with
Correct?
that.
That's what the DSM says.
Yes.
And based on the very limited information we have from Mr. Miller, we don't know why he is making that diagnosis after 5 years old, correct?
Right, I'm not sure why. I'm assuming that he would make a diagnosis the way anybody that is licensed would make a diagnosis.
And then you also review the records of a Dr. Reichenbacher,
Yes.
if I'm saying that correctly. And Mr. Reichenbacher is a psychiatrist.
Correct.
And
Anyway,
he,
we don't have time to play it all, but it gets pretty interesting. All right, so let me stop the share here. But if you look in the DSM, and that was another question I asked them, where is reactive attachment disorder? I want to ask you, where is reactive attachment disorder found in the DSM? Under what classification? Okay. And the answer to that is under trauma and stress disorders. Trauma and stress disorders is where you will find reactive attachment disorder. And I believe in my little pocket when it's the first diagnosis, it's the first diagnosis. All right. And so what we hear here is that guess what? And we find this in criterion D. Um, the disturbance is evident before age 5. So a good bit of my supervisors didn't recognize that because often we hear about individuals, children with reactive attachment disorder that are older kids. So you can have the diagnosis, however, it has to be diagnosed prior at age 5 or younger, right? Is what it's saying. Or before age 5, or there's caution. You need to have a good explanation why you're diagnosed, which gives us a better indication of what reactive attachment is, the harm that is caused by sometimes trauma, neglect, and things of that nature. A lack of consistency with caregivers impacts the child even before 5 years old, and the damage is done. That's why you check out RAD, or the one that I just said. Check it out. Um, Child of Rage. Check that out, and it breaks it down, and you see the damage. But if you follow the story, you see how you can also come out on a positive side, because she actually, the girl that was abused, she actually ended up think going into the field and becoming very successful, which is rare. But you learn about that anyway. We are at time, y'all. And so we're going to end it here. I do want to say that, you know what, if you are looking for any type of training as far as the DSM training, we have that. If you are looking for the DSM training that is required by the social work board, we have one of those for you. And some of you all are looking to be supervisors. We have a supervisor training. We got a lot of people signed up for that. That is on next month, July 27th and 28th. We would love to have you there. If you have any questions about that, let me know. And then we have the online on-demand DSM training, and then also Boundaries Without Burnout. A lot of people don't know about this. It's a newer one. 3 CEUs for supervisors. So if you're looking for supervision CEUs or any CEUs and you want to do these, check us out. We don't have free training for next month, July, but we will pick back up. We plan to pick back up in August. We're taking some time off for the summer. Hope you do too. We'll talk to you on next week. Take care. Bye-bye.